Hey guys, welcome to What Med Media. For those of you who are new to the page, I'm Dr. Kish and during COVID-19 and the pandemic, I've been doing a series of surgeries. It started out in March when I was doing a biohacking adventure where I was essentially trying to get fit to make sure that if I did contract COVID, then I would survive ideally. So I wanted to give you a little update on that and how the biohacking adventure is going. Just leaving the house, I saw Boris on the TV talking about dexamethasone. So it'd be really interesting to hear what your thoughts are on dexamethasone, because whilst I didn't see the press conference, I read a little bit of stuff in the papers and I'd be really keen to go through that. And also I wanted to share with you what it was like outside, because I don't know whether you know, I'm sure you do, but yesterday the shops opened up. So what's that like? So there's quite a lot to unpack there. 57 people watching already, which is great, so thanks so much for joining. If you could hit like, if you could hit share, if you could comment, I'd really appreciate it. As you can see, I'm in desperate need of a haircut. No offense to any of my barbers, but I would say that that's a non-essential thing at the moment. I did speak to Eddie, and Eddie is going to be opening come the 4th of July, which I think is great news. And he basically said he's my local barber in Watford. He goes, whatever we need to do, we will sort out. Just a quick reflection in terms of what it was like in town. It was surreal. Remember when this started in March? It was very different. It was almost like a dreamlike state. And I tell you what, wandering around the Harlequin in Watford, and I'm sure it's the same wherever you guys live, it was odd. Different shops doing different things. Apple didn't even get in the door, having a temperature check. If you do get into the shop, it's kind of, what do you want? Whereas other shops, you can wander around. I was in Lidl the other day and somebody was opening up all the air fresheners, sniffing them, touching them, putting them back. Absolutely crazy. Where have they been for the last 3 or 4 months? Unbelievable. No idea. Hey, Amy, hope you're well. Hey, Addy. So just while I'm going through some of this stuff and updating you on biohacking, I'll be really keen to hear what you guys think about this dexamethasone, because I've formed some opinions on it, and I'll be keen to share those with you. So basically, from the biohacking point of view, I think I've lost in the region of 12 kilos since March. I did a 90-kilometre bike ride yesterday, so I'm feeling a little bit delicate, and my legs are really, really sore, but I'm feeling a lot better for it. So that's the first thing. The other stuff that I think it's really worth letting you guys know is the way we're going to get through this is if we get through this, it is going to be a case of everybody looking out for each other's health. So I haven't got a mask on at the moment because I'm basically walking around a ring road, right? If I see somebody ahead of me, I will pull in and I'll make sure I don't near them. But the great thing, yeah, that's a really good point, Peach, exactly. That's one of the big things, right? You can look without touching when you're in a store. So let's try not touching stuff. Let's try and use gloves. Let's try and use alcohol gel, all that sort of stuff. So that's a really good point. Hey, Robert, thanks for that. Hey, Mario. Okay, cool. So from the dexamethasone thing, right? My concern about this is it's almost giving people false hope in terms of, yes, we're opening up the economy. Yes, I realise that. Yes, we need to make sure that the economy gets moving. I get that, because it's going to get really quiet in a minute. I'm really sorry. I get that for every increase in unemployment, the increase in suicide rate goes up, the increase in depression goes up. I get that you need a functioning economy, right? But my concern about the dexamethasone stuff is it's a bit of a distraction, because they're saying it cuts the rate of death for people that are on a ventilator by a third, if I heard that correctly, right? Now, my concern about this is you do not want to get on a ventilator at all. If at all possible, you do not want to contract COVID-19, because if you end up on a ventilator, a lot of people are not the same people that come off it, especially if they're on it for a prolonged period of time, right? So I guess what I'm trying to say is my concern about all this big media fanfare about dexamethasone is it still hasn't really changed my position in terms of wanting to make sure you do not contract this at all. Okay, and there's certain things that you guys can do. You can be fit, you can be healthy, you can maintain social distancing, you can wash your hands, you can wear masks where you go into shops and various other places. and just look out for one another. There's a great thing from the World Health Organization which says my mask protects you, your mask protects me, right? And I think it's got to the point where we can get over the slight awkwardness of, not shaking hands, not being in very close proximity to each other. So that's about it. 82 people watching. You must have questions. Nice quiet bit of road. I'm happy to walk up and down now. If you guys have any questions, what are your thoughts? Tell me what it's like where you are in the country. Are people maintaining social distancing? I saw something on Sky yesterday which essentially said that the return of the sales and shopping was essentially the end of the 2 metre social distancing. I have to say, everything that I saw in Watford, it was okay. It was good. People were respectful. They were staying within their own space. They're afraid to touch stuff. They're trying to give people a sense of security, so they go out, mingle and spend money. Yeah, so that was my thoughts exactly. That's my concern, right? I get the stay alert. You've obviously got to stay alert. But equally, if you're in your house, you still got to be alert in your house, don't get me wrong. Like washing down knobs and knockers and all that sort of stuff, like handles and doors is what I'm talking about. But yeah, that's an interesting point. So I'd be interested to see what, of the 73 people that are watching, what else you think. Because believe it or not, right, waiting for the second wave, people act as if it's gone away. Yeah, Claire, that's a concern, isn't it? The thing is though, right, guys, is we've actually got something quite special that's going on the What Med Media page, right? We're a community of people that essentially is getting knowledge out into the mainstream, which doesn't seem to want to be reported. And for instance, a couple of days ago, I posted something about that 20-year-old girl in Chicago, I think, or New York, that needed to have a double lung transplant. So it was a New York Times article. I saw it, I posted it, it went out there, it went to about 10 to 12,000 people. And it was really interesting for me to see the comments in the thread below, right? The conversations that are happening. You got people that are declining it as even existing, saying it's fake news, which it's amazing how anybody airs an opinion. Anybody, 1,000 new cases today, Alison, really, wow. I didn't see that part of the press conference. Because you know what, I've stopped watching it. And already somebody's put a sad on that, and it's affecting people. The media is making people more anxious, more concerned. I get that. No social distancing here. Queued yesterday. Oh, that's gone. Hi, Simon. How you doing? What's it like up in Lincoln? I can't keep up with that comment. So yeah, my concern essentially is I get that they've got to open the economy. They've got to do that. But my other concern is whether, all this talk about, I saw something I didn't read it yet, but the front page of the Daily Telegraph today was talking about how, essentially they were talking about, yeah, don't blame me, stop watching as well. Andy, that's very, very wise, mate. Very wise. But I saw something on the front page of the Daily Telegraph today saying that apparently some scientist somewhere was rubbishing the science behind the 2 meters, right? My question to you would be, who is that scientist paid by or for? Because if you sneeze, some of the early data in this was talking about if you cough or sneeze, and if you do contract COVID-19, coronavirus, the stuff that it does to your lungs in terms of coughing with projectile, real powerful, spreading it all over the place, that's going to spread 2 meters easily. And there was also data coming out that if you're going past somebody who's running, then you want to keep more than 2 meters away from them, maybe 10 meters, right? So my concern is this 2 meter rule, which people have just got their head around and are just starting to understand. If the case of changing it is purely a case for capacity in terms of getting people into shops again, then as a doctor, that concerns me. As a doctor, I think, well, let's critique it, let's appraise the science, and let's just make sure that everybody is fully aware of what's going on. Because going back to that post with those manky lungs that somebody was talking about as if it looked like something their cat had just thrown up, my take on it, considering that's gone to 12,000 people, so there's a pretty good market research poll there, my take on it is people do not understand the severity of it. People are still saying it's just flu. People are still saying there's nothing to worry about, which is obviously completely wrong. But the concern is it's very easy for people to say it's fake news with no further qualification. That's it. If you say something that people doesn't resonate with them and it upsets them, then they just dismiss it as fake news and they just try and shut it down. Then we've got President Trump in the States talking about, I had a bit of hydroxy, didn't do me any harm, I felt great. If these are the kind of leaders that we have, it's worrying. Chris made a good comment. Very sad to say, scientific illiteracy is rife in the UK. Yeah, I agree, it is. And that's why I didn't finish that thread or that chain of thought, right? But all the people that contribute to the What Med Media community are doing something that is very special. We've raised 660 quid, I think, now, out of 1,000. I will up it when we get to 1,000. That's paying for ads to put this kind of content out into the mainstream, to promote a discussion, to get people getting to know each other in the thread, to get people talking to each other. Even told people of my own time working in ITU. What? Even told people of my own time working in ITU over Easter and called a liar. Wow. Andy, that actually, maybe not. Maybe don't say where that is, Andy, but that's amazing. Wow. I'll tell you what, I'm going to stop and have a little read through some questions. And I might flip the camera so you guys can see my favourite hospital and my favourite football club, purely because I was born, in the hospital, not the football club. I'm desperate for a haircut, but my concern, this is Wendy Dyson. I'm desperate for a haircut, but concerned when hairdressers are opening regarding the aerosol effect from the hairdryers. What do you think? Wendy, that's a great question. Thanks very much. I think it's good from the point of view that you're saying that you're concerned about the hairdryers and the aerosol effect, because the same thing in terms of if the hairdryers in a toilet, remember with Dr. Blur when we were at his orthodontic practice, he made me wear these. Look, see, decided to wear the bands. He realised I wasn't. But if an orthodontist is saying, well, I'm not using the hairdryers because of aerosol effect, then, I don't know, you guess that it would be the same sort of thing for the hairdryers. So, I mean, as I've said to you, right, my kind of take on this is probably just grow my hair, to be honest. I get that's not possible for everybody. It's a good point though, Wendy, and it'll be interesting to see what the COVID secure guidelines say for hairdressers when they come out. It's one of the latest or last industries to be allowed to open, so we'll see. But that's a very good question. I'd probably avoid it. 2 meters is not enough. I've read stuff from Germany saying much more is necessary if we're even just walking. So Vanessa, I think it depends, right? I think it depends if somebody's coughing, spluttering, sweating all over the place. Certainly what I've seen is people are social distancing, and it's a case of getting your head away from your phones, looking up and making sure that you are protecting yourself and those around you, which I think is really important. Scientific illiteracy, we've done that comment. Should we be excited about the new breakthrough in treating patients with serious COVID symptoms? David, I think excited is a very strong word, David, and I would say no, I wouldn't be excited, because I think we need to treat this with the severity and the seriousness that it already has demonstrated. And I've seen in some of the comments, people are already saying, oh, people are thinking it's over. I think it's far from over. So I wouldn't be that excited about it at the moment, and I'd be keen to see the data. I'm in Sheffield. This is Jamie. To be honest, people act as if we didn't have a pandemic at all. No social distancing whatsoever. Wow. Rebecca, we have different rules in Scotland, so shops here not open yet. Rebecca, that's a good point, Rebecca. And I think the interesting thing on that is going to be with different home nations acting in different ways. If we get a big spike in England, then I think that's going to have some serious questions to be asked, isn't there? We've seen today how first thing in the morning, Boris Johnson and the government came out and said that there would be no free school dinners. And then 3 hours later, we saw a big U-turn as a result of Marcus Rashford's letter. So I think things can change, but I think we've got to unite, we've got to pull together, we've got to appraise the evidence. Ambulance going past. We've got to appraise the evidence. We've also got to make sure that people are appropriately educated. Let's see if there's any other little questions. I'm going to stop walking, read the questions. Might turn around so you can see some more of Watford General Hospital and the football club. This is why we now, whenever we give somebody GA, we wear full PPE. I'm not sure what that's coming to. Find it too depressing. I'm immune depressed and wonder if I ever get out again. Jane, I'm sorry to hear that, Jane. Try not to be depressed. It is difficult, I'm sure. Obviously, if you're in a shielding list, it's even harder. But yeah, I mean, just maybe drop me a message afterwards and we can chat. I can't really say more about this at the moment. And Vanessa, listening from Dorset, where the R rate is pretty high. Jeff, what about washable face masks? Are they any use, any good? So, yes, something is better than nothing in terms of 3-ply face masks made out of cotton or some kind of fabric or whatever. I think if you have a mask with the filters inside it, you need to change the filters regularly and get rid of them. I'm just glad that finally they've sorted out the PPE for the hospitals. So now that there's a point where we're allowed to say that we've got masks, because we need masks. Of course we need masks. I've been saying that for a while. At least we're in a situation now where, for instance, getting on public transport, you have to have a mask. The other point that I would say on that is, I've forgotten what I was going to say. Somebody with a mask walked past me, so it distracted me. Let's have a quick look. Don't blame me, stop watching. We've done that comment as well. Having trouble keeping my 22-year-old boy in. It's driving me crazy as he thinks it's gone. Nikki, yeah. I think the thing that we need to be really mindful of is young people. It's highly unlikely if they get it, they're going to be really sick. It is possible. I have heard cases of where 32-year-old bodybuilders who've been very, very fit ended up unwell and sadly dying with this. But yes, it's true. The vast majority of young people are going to be absolutely fine, right? If they get it. However, they're going to be spreading it. And that's why everybody needs to take it really, really seriously. Because whether it has a knock-on effect for them or not, we are in an absolute disaster of a situation where it's still the case where anybody can have it, anybody can be asymptomatic, you can still make other people sick with you being absolutely fine. So just scrolling back, seeing some of the other comments. Lorraine, my concern is the mental health side effects. I completely agree. I've said that right from the beginning, from the briefing video, which I said, right? Where we were saying, did they do a psychological impact assessment in terms of, this lockdown? Probably they didn't. I don't know. I haven't seen anything about it, but I think we need to be really careful. 106 people watching. That's brilliant. I'm reluctant to leave with such a great audience. So if you can ask any questions, because I've done all the pre-prepared stuff. They use sanitary towels in their masks in China. They're changeable. Might be harder to breathe though, Rob. It's interesting, I haven't seen that. Although I have seen in China, there's been another outbreak in Beijing. It's going to have to be quite careful about that. How are people handling disputes within households, family members to observe social distancing? Must be creating tension, no one talking about it. That's interesting, Musa. That's a good point. Lynn McGee, I'm a shielding group. When do you think I will get back to work? Okay, so I can't provide personalised advice, medical advice, obviously. I think my honest answer, however, is until there's a vaccine that's working and has been tested in people, I would be very concerned if government policy was suggesting anything other than until there's a vaccine, to be honest. But I don't know, we'll wait and see. And I think it's a bit of an unknown, isn't it, at the moment, if you're in a vulnerable group and you're shielding. So yeah, I think it's a case of, if you can kind of, you do the once a day exercise, which has now been allowed. And I think as long as you can do that, if you're fortunate to live in an area where it's possible, it is really important, because the longer that people with diabetes, for instance, that are shielding, are unable to leave their house, the more weight they're going to put on, the more depressed they're going to get, the more psychological impact there's going to get, and their overall immunity and their health will decrease as a result, right? So it is really, really important to try and get out if you can, that one time a day, because that's now the new shielding advice. If you feel comfortable, and if you live in an area where you can wander around, like I just show you here, right? So choosing to walk here, right? It's not the most, what's the word? Kind of greatest view, right? But can you see how it's completely deserted, because it's essentially a relief road for the hospital. So if you can find somewhere like that near you, if you can do something like that early in the morning or late in the evening, you will be better as a result for it, Lynn, I would suggest. But I think long-term way out of this is a vaccine. Let's see if there's any other questions, or we'll call it a day. There's an ambulance. Oh yeah, who have made recommendations of which fabrics to use in face masks, including a layer of polypropylene. So I've made masks for my family members. Well done, Edith, that's great. I remember one of my nursing colleagues, I can't remember her name, who was it? I think it might have been Natasha, started making masks early on in this, homemade, and absolutely ridiculed in the early days on social media, which is, I think, is a little bit unfortunate. So yeah, I think, you know, we need to be sensible. We need to wear masks if we can. We need to wear face coverings. Just like if you go into public transport in London now, you have to wear a mask, right? It's exactly the same in my mind. If you go into a shop, surely you have to wear a mask. Because if you go into hospitals, the hospital I work in London, St John's Wood and St Elizabeth, they basically said that you have to wear a mask all day, all the time. So why not all everywhere? I don't know. Just going through a scenic, that's the word. Thank you, Jasmine. It is scenic. That's exactly what I was looking for. Am I optimistic about a long-term vaccine, or is it looking more like flu in that we'll need new vaccinations periodically? Polly. So I think, yeah, potentially, because bearing in mind, it's worth mentioning that I don't think we've ever been able to successfully make a vaccine for coronaviruses. So that's the first thing. And one of the early things somebody from the World Health Organization said in this is we need to get used to this. It could be every year, hence the ominously named COVID-19. What we really don't want is a COVID-20, COVID-2021. So if it is mutating, which some of the data suggests that it is, because I think the strains that got to the UK were analysed, and it showed there was up to 30 or 40 different strains of this, or types of this. So it is a very real possibility that this could become a long-term thing, I think. That's my reading of it anyway. My mate is terrified. He's got asthma and using a steroid inhaler. Any advice, please? I would get him to talk to his GP or healthcare professional, because that's going a little bit towards personalised medical advice. I hope he's okay though, JB. Richard, my borough council leader, believes that the government will end up reducing the distance to 1 metre to try to rescue the economy. So I think we need to take a pragmatic view about this, right? And I think if people do maintain to that 1 metre, and they have masks and they sanitise their hands and they don't go out with symptoms, and if they're told to isolate they do, then I think it could be possible. But there's a lot of ifs there, right? And my honest kind of opinion on this is I think we've squandered our island advantage. Right at the beginning of this, we should have locked down and stopped flights in, as some other countries around the world did. And, you know, we also had a 2-week head start. Let's not forget that. So we need to make sure that everybody is switched on to this. Hey, Sarah, how you doing? Hope you're well. Probably getting stung by that. Yeah. Okay, don't know what that comment is. La 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 la. If somebody can tell me how long we've been going. Also, what it's like where you are. Oh, we have to wear a mask all the time now at Watford General Hospital, even when walking from my car to the car park. Andy, Whitney, cool. So maybe you're behind me. That's great. Police car going past. So the symptoms are different. No, Jeanette, that's a good question. Are the symptoms different for other strains? Not really, no. The symptoms are pretty much the same, to be honest. And look, so I can see somebody's coming, so I've just turned around. They're going to kind of take a wider path, I would have hoped as well. So that's just basically what we've got to do. We've got to be aware now, right? But the symptoms are not different for different strains. We've still got this thing where you've got a long or persistent cough that's new, a temperature, plus minus loss of sense of taste and or smell. Those are the real red flag symptoms. If everyone does it, big if. Yeah, I think that's a good point, Moose. No, on annual leave this week at home in Battersea, London. Nice. I'm on annual leave as well, Andy, actually. So it's good. Okay, so I think, unless you guys have got any questions, I'm going to call it a day, because I'm going to crack on with walking again. But thanks very much for watching. I guess just before I go, I should update you on the 650 quid crowdfunded so far. We've probably spent about $100 maybe. At the moment, the page is on reaching 460 or 470 odd thousand people. So we are making a difference. We are making a difference to people. And we're going to keep on crowdfunding. So after this, when I post the video, I'll put the link in the video. If you found this useful and you would like to contribute to the crowdfunding, please do. Because it's 100% used for Facebook ads. That's it. I've got the kit. I've got the data plans. I'm reading about this anyway. I'm not going to charge for my time for it because I need to be across it and I'm doing it anyway. So I want to put that information out into the public domain so that you guys can make sensible, informed, appraised decisions. And the other thing I would suggest is you talk to each other in the comments and get to know each other, as I can see some of you doing, which are great. So thank you very much for watching. I will put the crowdfunding link in the description. And if you could add whatever you can to contribute for some Facebook ads for this content, I would really, really appreciate it. So thanks so much for your time. Take care. I will try my best to get my eyebrows cut. I'll probably do the eyebrows before the hair. I'll still grow out the hair. And I will see you guys really, really soon. So thanks so much. Take care. See you later and look after yourselves.